Well, listen, we got a great program lined up for you today. But of course, in the midst of the COVID-19 that is going on, we have a guest who is going to be coming on with us in just a couple of minutes. His name is Dr. Ken Redcross. He's a medical doctor and the author of the book Bond, the 4 Cornerstones of a Lasting and Caring Relationship with Your Doctor. Runs his own concierge personalized medical practice designed to enhance the patient-doctor relationship while providing convenient access to a full spectrum of healthcare services and holistic and wellness counseling. He joins us today to discuss theories on why COVID-19 might be affecting more African Americans than any other population, including black children who are being hospitalized at a rate 5 times higher than white children, according to new data from the CDC. Comorbidities like hypertension, diabetes, and vitamin D deficiency are all tied to COVID-19 complications and disproportionately affect the black community. But the alarming rates at which COVID-19 is killing black Americans extends beyond these comorbidities and may be attributed to other factors such as equitable access to testing and treatment and withholding racial ethnicity data from reports on virus outcomes. Dr. Redcross will discuss recommended health changes that can help disproportionately affected communities. Dr. Redcross, welcome to the program, and thank you very much for joining us.
Thank you, Mark. Thanks for having me on. Good morning, everyone.
Yes. Okay.
Good morning.
So,
hi, Don. How are you?
I'm well, thank you.
Good.
Good. So, Dr. Redcross, in the midst of all of this politicization of COVID-19 that is going on, I'm afraid that we're missing the vital information that we really need, and that is the science and the practical behaviors that need to be employed and those things that we need to be focusing on. So you are saying that this, or at least it's Scientific American study is saying that it's racism, not genetics. Explain why black Americans are dying of COVID-19.
Well, I'll tell you this, Mark. You hit the nail right on the head. We don't want to lose sight of the ball. We want to make sure that we keep our eye on the prize. And the prize is for all of us to make sure we are healthy. So why are we affected? Because of the disease states that are rampant within our community, right? Whether we're talking about diabetes, high blood pressure, obesity, all of these are big factors, in heart disease as well. We are learning, and this is why it's so important to get on here this beautiful Sunday morning, that vitamin D, everyone, can play a major, major role because of what it can do for our immune system. So you're right. There's not necessarily only a genetic component at this. We know that there are some social determinants. When you look at some of the data that shows that up to 20% of African Americans are in the poverty line when it's only 10% of Caucasian Americans. So there are some things that necessarily need to be addressed. But you're right. This is about making sure that there's a call to action, Mark, that says, you know what? Let's make sure we check our vitamin D because it's so important for African Americans in particular, because 80% of us are deficient in vitamin D. And now that we're learning how important it is potentially for COVID, it's even more important that we get out there and know our levels.
How do you see the current racial breaking point affecting healthcare for black Americans?
Well, to be honest, Mark, this isn't really new as far as I'm concerned. I've been in practice over 20 years, and so these healthcare disparities have always been there, everyone. It's just the fact that coronavirus has actually just shone a light on what I've known for 2 decades. And so, it's funny how the good Lord works, because the coronavirus has been awful, of course, for our community, but it's also given us kind of a step up to say, you know what, we need help and support, and we haven't really been getting that from the healthcare community, which is the reason why there's so much skepticism as far as in our community when it comes to healthcare and how we're treated throughout the healthcare system.
Now, here in Chicago, as I drive around and see certain things, certain behaviors in our communities, of gatherings. I see that on certain groups that are gathering, that there is either a reluctance to or a defiance in terms of doing certain things like wearing masks. What do you think has contributed to the spike in COVID-19 deaths for Black communities?
Yeah, and lots of times it's because if you really think about it, especially for a lot of us in our communities, social distancing is a luxury. It isn't something that we can necessarily do so easily. You know, we can talk about masks, we can talk about hand washing, and that's why today I'm saying, okay, everyone, we know the three things we should do: hand wash, 6 feet, mask, but what can we do to take us to that next level to help protect our health? And that's why I talk about vitamin D being so important, everyone. In fact, someone else asked me earlier, Mark, I was on another show, and they were like, well, Doc, how much vitamin D should I take? Well, the thing is that I want your levels to be between 40 and 60, and there's even a website called thepowerofd.org. I mentioned this one in particular, Mark, because once you get your lab test, once you know what your vitamin D level is, when you go to that website, you can put that information in, and it'll calculate the exact doses that you should have. But it's important, everyone, because vitamin D is important for each arm of the immune system. It's inexpensive, and it's something that we are lacking. So today is a big, big call to action. In fact, I'm challenging everyone to get on my level as far as my vitamin D level. Mine is 67. And when we get off of here, Mark, I hope that you and Don say, Doc, I'm going to get on your level too, and I want to be between 40 and 60, because we have to get to healing as a community, and we need to start today.
And so what are some of those practices that we can do to get to those levels?
Well, so now, as you guys may have had a chance to look up, I'm on the natural side of healing. I train here in Columbia, so I'm a Western-trained physician. But over the years, I've learned that there's alternative ways of healing, and there's nothing more beautiful than really a blessing from God when you talk about vitamin D, because the sun is how we get that. But for us, we have more melanin in our skin. And because the melanin is in our skin, it blocks out some of the sun's rays, so we don't necessarily get as much as we actually need. Not to mention, our diets are not particularly rich in vitamin D. People will mention milk, but milk is fortified with vitamin D, meaning it's only added. So therefore, the best way you're going to get vitamin D, especially in our community, is to supplement. And so that's why I mentioned between 40 and 60 are the levels. That's why I mentioned that thepowerofd.org, there is tons of information, tons of studies that show that vitamin D can help protect us from flus and colds. Vitamin D can help us with our insulin levels, which so many of us are dealing with diabetes. And we know it can also help with obesity as well. And these are things that I am trying to get out into our community and to make sure, as I say, that you get on my level so that we make almost a game and a challenge out of it for our community to say, you know what, I'm going to get on Dr. Redcross's level, or I want to be between that 40 and 60, and make sure we start taking care of our health, but once again, for the here and the now.
Well, we got just about a couple of minutes left here. Generally speaking, what are your Black patients most skeptical of compared to your white patients when it comes to COVID-19?
Oh, wow. I only have to say two words: Tuskegee experiment. Even though that was years ago, even way back in 1972, that's something that we can't forget as a community, of how we were mistreated and misled. And that's something that's going to take years, as you see, to actually get out of our system. So that's why when we're talking about vitamin D and we're talking about being between 40 and 60, the messenger is an important factor in all of this. And so I'm a messenger that looks like us. I absolutely care about all health, and especially Black health. And so that message is important for us to get out there and say, you know what, I'm going to get on Dr. Redcross's level. I'm going to get my vitamin D. I'm going to either go to my doctor, or even at that powerofd.org site, you can order an at-home test kit to be sent home and get your levels that way. But once again, everyone, this is a call to action, and let's start focusing on our health, because our health matters as well.
All right.
Doc, I had a question there. That metric that you just spoke of, the 40 to 60, is that the milligrams, 40 to 60 milligrams per day?
Oh, okay. I'm so glad you asked me that, Don. So everyone, that's not the doses of the vitamin D. That's actually the levels. That's usually measured in what we call nanograms. In other words, that's a measure at the lab itself. That's the range we want to go in. When I talk to patients about doses, especially us, I tend to talk about 5,000 international units. That's over the counter in the form of D3, everyone. So, Don, thanks for that question. That 40 to 60, everyone, that's just a range that when you get your lab test, whether you get it from the powerofd.org or at your doctor's office, when you get that number, he or she is going to give you a number. And we want our numbers to be between 40 and 60 because that's where we get a lot of the medical benefit that we're seeing in the trials and the studies.
All right, Dr. Redcross, Dr. Ken Redcross, who is a medical doctor. We certainly appreciate that information, and you want to get more information, you can go to his website at drkenredcross.com and thepowerofd.org or at Twitter at Ken Redcross MD, and his Facebook page at facebook.com/Ken Redcross MD, and at Instagram, Dr. Ken Redcross. Thank you very much, Doc.
Very good. Take care, everyone. Have a blessed day. Reach out, please. Say hello. I'd love to meet new people and help everyone through this.
Certainly appreciate that. Thank you so much.
All right, guys. Have a blessed one. Bye-bye.
All right.